Coercion in healthcare is basically a practice that is used to persuade a person to do something against their own will that they are not inclined to do by using force. This force could either be threats, physical attacks, or blackmail. An example of this could be a patient. A patient has rights, whether they are regular admitted patients needing medical care, or they're critical patients, or they're just wound patients, even dying patients at some point have rights. So you, as a healthcare professional, cannot administer treatment to a patient without letting them know, and you cannot administer treatment without letting them know what kind of treatment it is and what the treatment is for. So if a patient, for certain maybe religious beliefs or ethical beliefs or moral beliefs, believes that this certain treatment is not for them, or they do not want to be given this type of treatment, you as a healthcare worker cannot threaten the patient and say, if you don't take this medication, I'm gonna hold this gun to your head. You cannot use threats. You cannot at all. It is unethical. The clinical scenario states, Mrs. Grigorova is a 43-year-old patient who was in an accident in which she fractured her pelvis, right femur, thigh bone, and right forearm. After a long hospitalization, the doctor plans to discharge Mrs. Grigorova. She cannot ambulate or walk and has difficulty feeding herself with her left hand. Consider how Mrs. Grigorova will move through the healthcare system to regain her self-care ability. Most probably need to move, in my opinion, to a subacute facility. To a subacute care facility. So in our case scenario, we are told that she's been hospitalized for a long time, and then the doctor decided to discharge her. So patients who still need a bit of medical care, in this case we are told that she fractured her hip bone and immobilized her forearm, so she would need more care. But in those cases, some patients who have been hospitalized for a long time probably have depleted their medical funds, and medical aid can be a bit expensive. So the best, much more affordable way is to move to a subacute care facility where she would still be taken care of. Her needs will still be met. She will have someone to assist her since she cannot walk and she cannot do basic needs for herself. Here, she would also have access to physiotherapy just to get her back up again. And in the case whereby she's feeling good, she's feeling well, she's okay, and she has healed, she can go home. No, Miss Grigorova cannot continue living in her apartment as she was living alone. There will be no one to take care of her because she cannot move and she cannot feed herself in the one forearm that is immobilized. So she's definitely going to need some physical and emotional assistance. So she cannot live alone. So in the case whereby she has lived in a subacute care facility and she has still not healed, she will be then moved to either home care, and home care will have a healthcare professional taking care of her, or she can move to other facilities. These facilities include a long-term care facilities such as nurses' homes, whereby she'd still have the same benefits at her disposal, and as well as an assisted living facility.